first 25,000 doses of COVID-19 vaccines for children ages 5 to 11 will arrive in the country next week. Welcome to your COVID-19 update for today, Friday, June 3, 2022. I'm Natasha Smith-Thomas.
So in the last 24 hours, we were able to diagnose 100 new cases. So our active cases right now is at 873 cases. And of those cases, we have 27 persons right now in hospitals across Guyana. 17 of that 27 is at Ocean View. And we currently have 2 persons in the ICU. Vaccination, we are trying to get those numbers up. We have done relatively well, I would say, with the primary doses. So our first dose for adult is now at 442,395. That's about 86.2% of our adult population. Second dose is now 342,021 doses. That's about 66.7% of our population, adult population. I think where we have difficulties would be with the adolescent population. So 12 to 17, we have actually, just having incremental numbers of young people coming forward to get vaccinated. And part of the difficulty here has been the need for permission from parents. So if a young person does not have permission from their parents, we cannot vaccinate them. And so these numbers have remained relatively low. So first dose is 34,726 doses. That's about 47.6% of that age cohort between 12 to 17. And second dose is now 25,451 doses, or 34.9% of that age cohort. So the point here is that if we are going to increase these numbers, we need the cooperation, collaboration of parents, because the variant that is circulating is more infectious, and therefore if we want to prevent long COVID and the effects of the severity of the disease and so forth, it is better to be vaccinated. And unfortunately, while we have vaccines available, we're not seeing people coming forward to take the vaccines. From next week, we will be introducing the vaccines for children 5 to 11 years of age. These are special formulation. This is not the regular vaccines that we've been giving. This would be a special vaccine made by Pfizer, especially for this age category. And therefore, I would urge parents with children within this age category of 5 to 11 to bring their children out to make sure that they're vaccinated. We have limited supply, and so it would be on a first-come, first-served basis when we start rolling this out. We would have enough vaccines for 25,000 children in the first tranche of vaccines that we'll be giving. So those persons who are interested, they would have to make sure that they come out early and get the vaccines for their children. In addition to that, because of the age group, the parents can accompany the child so that we can give the vaccine, or they would have to give written permission so that we can administer the vaccine. Masking is very effective at slowing down the dynamics of the disease and reducing the spread of infection. But we have to get people wearing masks. As it is right now, I think a lot of people have become very complacent and they don't want to wear masks. But while a lot of people have stopped wearing masks, what we're seeing is an increase in cases. The increase that we have seen so far might be an underestimate because a lot of people who would have had the symptoms of COVID might not have recognized them as COVID symptoms because they are generally upper respiratory tract infection symptoms, meaning you can have a runny nose, congested nose, sore throat, that sort of thing, a little bit of fever. So these symptoms mimic, you get similar symptoms when you get influenza, or what people commonly refer to as a flu. But what you might interpret as a flu might be COVID-19. So the better thing to do is to do an antigen test or to do a PCR, just to make sure that you're not infected with SARS-CoV-2 virus.
You have been watching the Daily COVID-19 Update for today, June 3, 2022. I'm Natasha Smith-Thomas. Goodbye.